Welcome to this second episode, second session of our webinar series on Caribbean climate and health. It's a workshop series that we put together here at Earth Medic, Earth Nurse in partnership and collaboration with Columbia Mailman School of Public Health, and specifically their global consortium on climate, and health and education, along with our Healthy Caribbean Coalition. So welcome again to our second session in our series. My name is Dr. Carrie Ann Peart, and I am one of the associates with Earth Medic, Earth Nurse, and I focus primarily on the public health intersection with psychology. So I've married those two areas of my career together, and ta-da, here I am. So I'm your moderator for this evening, and we'll be moving you through our presentation. So just really quickly, again, wanting to give formal thanks and recognition to our partners, the Global Consortium on Climate and Health Education, as well as the Healthy Caribbean Coalition. Without their partnership, a lot of this would not be possible because you go further as a collective than you do by yourself. So we are very grateful for their time, support, and resources as well. To recap, as I said earlier, this is the second session in our workshop series. And just really briefly, I want to remind us all about the learning objectives for our series. I'm sorry, Haley, could you just mute folks for me, please? Thank you. So first and foremost, the series is hoping to, accomplish these things, explaining how climate change interacts with our physical and social environment to alter the risks and vulnerability for mental disorders. That's what we focus on this evening. Also wanting to explain what actions practitioners, patients, and communities can take in order to reduce the risk and adverse impact of the climate risk health issues that we're seeing. A lot of folks are still in this, in this kind of space of denial that climate change impacts our physical and emotional well-being. And so that is something that is paramount for us to help connect folks with during our series. And thirdly, identifying 3 priorities for the action in terms of research, specifically for tonight's conversation around mental health and climate change within the Caribbean. The series is focused again on the Caribbean context, but we of course welcome stories from other parts of the world because we do share similarities more often than differences. So a lot of this is kind of going to be touching on things that other people in other parts of the world potentially already faced or are currently facing as well. So that's tonight's kind of focus, and also just generally what we're looking at when it comes to the other topics we'll be addressing throughout the series, really being critical about non-communicable diseases as they intersect with climate change issues and health outcomes that we are observing. Tonight, our guest speaker is Dr. Angela Gordon-Stair, and I get the pleasure of introducing Dr. Gordon-Stair for tonight's conversation and presentation. So Dr. Angela Gordon-Stair was a senior counselor and head of the counseling service of the University of the West Indies at Mona, which is located in Jamaica, until her retirement in 2019. She's a licensed professional counselor by training, and Dr. Gordon-Stair has been participating as a counselor since 1976, and is involved in various outreach activities. As a volunteer with the Jamaica Red Cross, she headed the mental health and psychosocial support program for that organization up to June 2021. She is the Jamaican Psychological Society's representative on the Disaster Mental Health Committee, a subcommittee of the Caribbean Alliance of National Psychological Associations, otherwise known as CANPA. She has also published papers in international journals, as well as book chapters, and is the co-author of the book, Child Adoption, Managing Losses, Achieving Caregiving Solutions. She continues to be involved in teaching at the postgraduate level at the University of the West Indies, Mona, again in Jamaica, and does a very small private practice. Welcome to our discussion tonight, Dr. Gordon Stair. Thank you so much, and we'll have you get ready for your presentation.
Thank you so much. It is my pleasure to be with you this evening. And I want to start by asking everybody to do a mental exercise for me. I want you, if you have ever been experienced a severe weather event, I want you to think back to that experience and think back to what it was like emotionally going through that and afterwards. Just think about that. For those who may never have experienced one, we see a lot on the news. I want you to think back to one you have seen recently on the news and what your thoughts and emotions were as people were being interviewed, as you saw the devastation and destruction. What was that like for you? I just want you to take a minute to think about that. And I'm not going to ask you to talk about it, but just to set the scene for what it is we're trying to do. Okay, I see some people putting things in the chat. My interest in mental health disaster work, in particular around severe climate and weather events, was as a result of my experience with the Hurricane Gilbert in 1988, which devastated Jamaica. At the time, I had responsibility for a hall of residence on the Mona campus in Jamaica. And thank God there were not many students around because school had not started back after the summer break. But I was able to see myself going through that and the aftermath of that. And I also recognized my own emotional responses, a lot of anxiety, a lot of flashbacks. And I said, if this was happening to me, what was happening to other people? That's where my interest started. I was curious about how we respond in situations like this. Next slide, please. So when we talk about climate change, we're talking about any change in climate over time, whether it's due to a natural variability or as a result of human activity. And we see it in things like changes in the oceans, the ocean temperature, land, and polar ice. We see the impact of these climatic changes in increased temperatures. We see severe storms. We see increased droughts, wildfires. All of these things impact well-being and livelihood. And livelihood impacts well-being as well. So, and these things are happening throughout the world. In the Caribbean, the main focus for us are hurricanes and volcanic activity with flooding. Next slide, please. All right. So we have physical and mental health, which is threatened by climatic change. And we can move on. We see the mental health. I won't talk so much about the physical health, but the mental health responses, some of that, post-traumatic stress, depression, anxiety, substance abuse, suicidal ideation, and in many cases, completion, and exacerbation of mental illnesses. So it is impacting just about everything. Next slide, please. Okay, so we have changes in the landscape. We have changes in habitation. If you have experience in the flooding, you see farms being washed out, you see roads being damaged, you see bridges being washed away. So the entire structure of the environment, and this has implications for people's livelihood. Those who have farms, those who have to get to work, disruption in transportation, all of that. We see relationship stress, and oftentimes this presents in gender-based violence, abuse of children. And the interesting thing is we're seeing a lot of this as a well, I shouldn't say post-COVID because COVID isn't over, but we're seeing a lot of these psychological responses after. Then there's the despair and hopelessness, the feelings that all that I have worked for is gone. Next slide, please. So who are the most vulnerable? Usually low-income communities are among our most vulnerable. The structures that are available, where they are built, their ability to recover makes them highly vulnerable. We have communities where they are reliant on the environment for their livelihood. Farms, fisheries, fishery communities, populations living in areas susceptible to climate change, and we have reduced physical mobility. We have those as children, the elderly, and those with disabilities. They are very vulnerable in situations of worsened environmental changes that are as a result of the climatic changes. And then, of course, we have the pre-existing mental health challenges. Those who have a diagnosed mental illness, they are very vulnerable. Now, some of these are the peoples and populations who often have inadequate access to mental health services and resources. And so we have to bear this in mind as we talk about these things. Next slide, please. Now, since 2007, mental media reports and academic literature has looked more at, it's showing that people are beginning to look at climate change on health and how health is being impacted. However, as with most things health related, there has been a focus on physical health more than there has been on mental health, in spite of the fact that in most cases of severe weather events, the psychological impact from any form of disaster exceeds the physical injury by about 40 to 1. And we do know that since 2000, there has been an increase in climate change related weather disasters. It is estimated that this is about 46%. Next slide. So as we were saying, there have been many events from Gilbert in 1988 to we had Hurricane Ian in 2022. We have the wildfires in California. We had the floods in Pakistan. Much of the Caribbean was affected by Irma and Maria in 2017. And one of the things we have found is that in many situations, these have been seen as discrete events as opposed to events that are related to climatic change. This has implications for our response as well as our preparedness and our mitigation activities. Because if we're not seeing the connections, as was said earlier, there are still those who are denying climate change. And until we begin to make those connections, then we cannot plan, we cannot intervene in a meaningful sort of way. Next slide, please. Now, one of the things in the Caribbean is that we tend to see many of these events as acts of God. They are accidental, they are not preventable. But as we begin to understand the connection between climate change and these events, we begin to understand that some of these things are preventable. It has implications for how people respond. There's going to be greater anger, there's going to be greater upset, there's going to be greater rage at those who are seen as the perpetrators of the things that are inducing climatic change and hence severe weather events. Next slide, please. Okay, the hazards, you have those acute ones, which are like floods and hurricanes. You have subacute, which are pervasive droughts, as is happening in parts of Africa, in the Sudan region right now. And then you have the chronic things like the melting polar ice caps. These lead to direct, indirect, and overarching psychosocial consequences. Next slide. So what are some of the psychosocial consequences? The direct events, trauma, which is oftentimes related to floods, hurricanes, wildfires, and heat waves. In terms of indirect, we have social and economic and environmental disruptions, famine, civil conflicts, displacement, mitigation, and migration. The overarching psychosocial consequences we see in terms of long-term emotional distress as a result of the awareness of the threats and impacts of climate change on human and planet well-being. Next, please. I don't want to delve too much into this, but in terms of extreme heat, I think it's important for us to understand that extreme heat is not just the loss of physical property or the loss of life, but it has implications for one's mood, and behavioral disorders. For example, schizophrenia, mania, and neurotic disorders. It also has implications for those who have impaired thermoregulation, that is, those with pre-existing mental health issues, or some people may be taking some medication for pre-existing mental health issues that the medication itself makes them susceptible to this dysregulation. And of course, wildfires, anxiety, depression, and PTSD. Next slide, please. Hurricanes and floodings. This is what we tend to see a lot of in the Caribbean. The pre-disaster, the anticipatory disaster, anxiety. I knew that every time the hurricane season came around, the 1st of June, I became anxious. The post-disaster, PTSD, depression, worsening of pre-existing vulnerabilities. And we know that after Hurricane Katrina, 20 to 35% of the survivors were estimated to have experienced some kind of mental health issue. Next, please. the indirect mental health consequences, long-term droughts, rising sea levels. Again, implications for the land, for people's livelihoods, for people's where they live, what they have known as home, and the implications for their mental well-being. Many people who live and are dependent on the sea or the land, there is income insecurity. And this increases the suicide risk. We know that the research is showing that in places like India, where there is drought or floods, the suicide rate goes up. Next slide, please. Solastalgia is a term that has been coined, and it speaks about the distress that is induced and experienced as a result of the environmental change, impacting those directly connected to their home environment. It's the same as if you're away from home and you experience nostalgia. Here you are present, but it is as a result of the degradation of the environment around you. It's no longer the place that you knew as a child that you called home. You see it slowly changing before your eyes. And of course, many experience climate change as a vicarious threat. And this is why I ask you, for those who have never had the experience, the direct experience, you see it on the news every day. It affects your emotional response. And it's now something that we're talking more and more about, climate change and the environmental threats, and the sense of helplessness and hopelessness that many are experiencing. Next slide. Okay, what can we do as healthcare professionals? I think it is important that we educate ourselves and educate the wider community on the adverse impact of climate change on mental health, and how to mitigate against and adapt to those changes. What are some of the behavioral changes that we have to make? Not just in terms of the individual, but as a community. How do we change our behavior so as to protect the environment? To develop healthcare curricula to highlight the impact of the environment on health and mental health in particular. I think we have to begin to look at the training that healthcare professionals receive and begin to understand that we have to, climate change and its impact on health has to be a critical part of that curriculum now. We have to prepare the mental health community to engage in climate-related emergencies. No longer can we sit in our offices and wait for people to come for us. There are many organizations that are involved in response. Get involved with them. And of course, psychological adaptation requires coping strategies to cope with the feelings and thoughts. How can we help people to deal with those thoughts and those feelings that come either before, during, and after a major weather event? And of course, promoting emotional resiliency, especially in vulnerable communities. How do we do that? The social engagement, how do we help people to socially engage? We've reached a stage in many communities where the individual takes priority over the community. We have to get back to the community supporting themselves and supporting each other. One's spirituality and one's mental health literacy. In the Caribbean, there's still a stigma against mental health, mental ill health, and people don't want to talk about it. But if we are able to educate people that what you are experiencing is quite normal and begin to understand, just as we say to people, get your emergency kits ready before a hurricane. What are we doing to educate the community, to help the community to understand what are some of the emotional responses they may experience? What are some of the emotional responses children may experience? And how are we helping them to understand what to expect in terms of their emotional responses and their emotional well-being? If we can help people to see it in the broader context of preparedness, then I think we would have been doing a service to the community. Next slide. These are just some of the responses that we have seen with the Jamaica Red Cross, meeting people where they are. This is Hurricane Maria in Dominica. We work with the Dominican Red Cross in that response. The next slide. This again is when Hurricane Dorian in Bahamas in 2010, I think it was, yes, or 2019, sorry. And then we had the COVID-19 response in Jamaica. Again, major disruptions in people's lives. In all these responses, we are meeting people where they are at. We are also linking the psychosocial with all other responses. So the question for me is, what do we do? With all of this happening, what do we do? In the Caribbean, we have opportunities to develop responses, but how are we doing that is important. For example, coming out of COVID-19, in Jamaica was a vulnerable persons registry. And I think this is something that we can look at throughout the Caribbean. And it doesn't have to, it just happened in Jamaica that the Jamaica Red Cross was asked by the government of Jamaica to find the vulnerable people in the various communities. And what that can be used to map and to follow through to help to secure those who are vulnerable. This vulnerability was for people over 75, people with health issues, including mental health issues, and people who lived in vulnerable communities. So that's one thing that can be done. A second thing that we have done in Jamaica through the Jamaica Red Cross is we have what are known as community disaster response teams. There are 48 such teams, and it's community-based. It's the people in the community who are part of that team, and they are based in vulnerable communities. Like I said, in our situation, hurricanes and flooding, landslides are our major things. So in communities that are vulnerable to those activities, they have trained people in the community. And part of the training, a module in that training is psychological first aid, so that people can respond, not only to be able to say, well, the river is rising, so people have to move, or there is a threat of a hurricane, so let's get the community moving, let's do an evacuation, but also how do you help people to understand their emotional, how do you care for people understanding their emotional responses? And as part of the CDRT training, these community members, and they don't have to be psychologists or any, they, you know, the farmer, the dressmaker, they are part of the team. And one of the things they learn is to be able to identify those who are in distress, how to make referrals if needed, but also how to just be able to listen and talk to people and allow people to talk about what is happening to them emotionally. Another thing I think we have we have to look at is helping all healthcare workers, including psychologists, psychiatrists, to have some psychological first aid training, because it's reaching people where they are at in the situation immediately. Just having some, because we know that the vast majority of people will not need psychological intervention. What they need is for somebody to hear them to say, I understand, I hear you. This must be difficult for you at this point. So that is something that we can look at, because climate change and major weather events are only going to get worse. In that regard, I'm a pessimist. I don't see it getting better for now. But we have to look at what tools do we have in the toolbox to assist. The other thing I think we have to do in the Caribbean, we have to look at what our research agenda is. We have to begin to understand what is the vulnerability, the mental health vulnerability in the Caribbean to severe weather events. We know it happens, but I don't think we have enough data. There is some research, but I think we need more, and I think we need more targeted research. The second thing I think we need is to begin to understand that the community can help itself. With help, the community can help itself, and that should be the first port of call. And I think we need to look at this. The other thing I think we need to look at how the community can help itself. The other thing I think we need to do is look at how non-healthcare institutions in the community can be a source of helping people to mitigate the mental health risk, the mental health disaster in terms of their well-being. What do I mean by that? There are many communities I know in Jamaica where at a church there is a health facility where nurses and a doctor who are members of the church run a health clinic, maybe once a month, sometimes twice a month, for people in the community, not just church members. Can we use those kinds of institutions to help to educate our community about the impact of climate change on mental health? How can that be done, if it can be done? That is, for me, another area that we can do some research in. Next slide, please.
Sorry, Dr. Gordon, is it possible to wrap up in the next minute?
Yes, I'm done.
Thank you.
Done. That is it for me.
All right. Thank you so much, because you really gave us a lot to chew on here for this. And much of it too, we have been discussing internally as a team to highlight how we educate people about these intersections, because what we're really talking about are the intersections of health overall. We love to hype the social determinants, but also forget how they intersect. Mm-hmm. So thank you so much for elevating so many of the intersections and making it real for people to understand when floods come, the stressors happen and people respond accordingly, you know, given their context. I mean, sometimes the response is harsh in terms of the suicide rates that we see going up or the domestic abuse issues that we see on the rise. But there are also some very internalized responses as well that we don't see that then become severe issues down the line. So thank you so much for elevating the reality of the situation that we face in the Caribbean and other global communities as well, face as well. So thank you so much for that. So folks, we wanted to transition now and have our work groups do their infographics. We have work groups within Earth Medic, Earth Nurse that have developed particular education materials that are kind of in drafting process. And this is a space where we like to present those, and we'll have work group 1 get ready to load their infographic. And this is a space where we like to present those pieces to you, to all of you, to gain feedback in real time, so to speak. And, you know, put questions in the chat or thoughts in the chat when you see these pieces. Each work group will have 5 minutes. We want to stick to the schedule as we move forward with some other exercises. So we'll have our work group member number 1, I believe it's Keslin, who will be presenting their infographic. And I'll turn it over to you, Keslin. Thank you.
Hello to everyone and welcome to tonight's session. We've been looking forward to it. So for work group 1, we're talking about building resistance when it comes to mental health and climate change. And so our group focused on patients and communities, or individuals and the communities. So that was our audience. And we wanted to find out what kind of information can we give these persons? How can we share with them about climate change while still focusing on mental health? What is something that's most common to households when we think of disaster? And this is what we're looking at here. You know, all these different climate events, these are disasters in itself. And how can we ensure that that information is given to everyone and translated? So we took a disaster management approach to our document, and we decided to create something that might be familiar to most people, at least, you know, for in the Caribbean, here at home as well. We're very used to these ideas. So when we look here, we came up with a simple brochure for our presentation. And we took looking at before, during, and after, similar to what you will see in maybe a hurricane preparedness manual, or what you would see for a fire awareness manual or for flooding. And it's something that's very common that you might see. It gives you a step-by-step. It helps you to prepare and keep in the mindset of what you would do in this particular space of time. And when we decided on what we wanted to do, we wanted to make it very easy for others to understand. And we wanted to ensure that the information is there, but that we also include very vital things for you to do, because in all these times, there's a lot of information that's going to be shared, and we want something that they can get the big information from. And so this is the inside of our brochure here. We focus on what people can do, what the communities can do. We also broke it down into areas of where you can get medical information or just general information sharing. And now we have the outside as well, of our brochure here. So as I said, it goes through the before, during, and after. It covers those main areas. When you think about some of the major points that came from gathering this information, things that we really wanted to get across, one of the biggest things, as we heard in the previous presentation, is ensuring safety throughout. And so planning for safety at the shelters was something that's very important. When we hear about disasters, we also hear the very troublesome news of there being crime within shelters, as well as you hear stories of violence, sexual violence inside of these areas. So this is something that we really wanted to highlight, that communities are planning for these, that these big institutions have these things in place. Also, we spoke about the sharing of information and ensuring that what is shared is actually truthful, accurate, time sensitive, and in a way we wanted to ensure that we're telling you to listen to the information, definitely keep in touch, but also know when to dial back and pull yourself away from it so that you can focus a little bit more on your mental well-being as well as your physical well-being. And we heard in the previous presentation about psychological first aid, and this is very important because the more our community members are able to help each other, the better off we will all be. And so we thought of something very simple. You could stick it on the top of your refrigerator. You can have it on the bulletin board of your office. So something very easy to read, flip over and get this information from. All right, thank you.
Thank you, Kirsten. Now, you know, I'm biased because I love it. But please, folks, if you have questions or thoughts about these pieces, please plug them. Sorry, we'll have a moment as well to have further conversation after work group 2. I believe, Desayev, you will be loading your deck. Because again, we want to be able to present these to you, see if they would be applicable in your communities. Of course, we understand language has to be translated, and we also recognize that some words in English do not exist in other languages. So we definitely want your feedback as to how these things could be adapted for your communities. So keep these pictures in mind as we go through in our breakout. So who is the target population for this health education? Keston, this was for?
This was focusing on individuals, patients are individuals, and communities. So community institutions such as your NGOs, your church group, your social clubs, your youth club.
Right. Perfect. Thank you, Keslin. Thank you, Yvonne, for that question. So yes, we are working on different audience members. So that's why it's wonderful to have this setting in order to kind of get real-time thoughts about it. Yes, absolutely. Literacy levels is definitely a piece of consideration for the development of these materials. And hence the reason why we've made it flexible enough to adjust for those varying degrees of nuance. Myself as someone in psychology and understanding the levels of diversity and equity that we need, it's very important that our teams create materials that will be flexible for varying communities. All right, so I believe Desayev is with us again. Desayev, would you like to go ahead and load for your work group 2 infographic discussion? And you also have 5 minutes. Thank you so much, Keston. That was beautiful.
Hi, good evening, everyone. I'm Abigail Liverpool, and I'll be presenting for Group 2. Yes, DECF is our group chair. So we looked at developing an infographic for the health professionals and what they should know when it comes to climate change and health. So here is our first infographic. It's basically a pamphlet that looks at, we focus on what are some of the potential effects of climate change and health. And then we also looked at mental health risk associated with climate change. There's the risk factors associated with the affected or the vulnerable communities. The psychological impacts of climate change. Oh, sorry, this bar is affecting my screen. Okay, I think I'm back. I'm having some technical difficulties here. Okay, yes, the psychological impacts affecting climate change in mental health and the mental health resilience that is needed for health professionals related to climate change. Yes, in our group, we are focusing on the health professionals and how they should react to climate change and mental health. And most of all, it includes knowing what or the impacts of climate change on mental health for the health professional and for the community which they would be serving. Lower second infographic, we look at what the health professional how should a health professional assist the community with climate change related mental health issues. And in this graphic, we identified the vulnerable groups. We identified the mental health issues that are affecting the vulnerable groups and some interventions or actions which can be used to mitigate or adapt to the impacts of climate change on mental health. So these are the first two graphics that we produced. We also have an expert in mental climate change and health professional who is Dr. Hiba Mutab Ali, and Hiba is going to continue from this point and present the presentation on the health professionals. Over to you, Hiba.
Thank you, Abigail. Thank you very much. So I'm now going to talk about the effect of health professionals on the mental health of health professionals that happen due to climate change and due to disaster. So to start off, I would like to say, I'm talking from Australia, and I would like to pay my respect to the elders past and present and extend this respect to all Aboriginal and Torres Strait in Australia. So let us talk about what happened to the health professionals. So during disaster, people tend to forget that health professionals are human beings with families to look after and protect. In addition, they have to provide care for others. So the distress felt may be overwhelming. So let us think about the exposure of climate change would add to the increased job demands and decrease available resources for health professionals, and this will result in exhaustion and cynicism, low self-efficacy among employees, excessive stress and burnout, and disturbed sleep and other health problems like poor emotional health and other health problems. And now let us go to the effect of disasters on the health workers. So they may feel, like distracted between their work and their families and their other situations, like people they have to look after and take care of them. So they feel numbing, heightened arousal, diffuse anxiety, and loss of a sense of safety. And finally, there is a problem of survivor guilt, which affects many times this problem affects the health professional. Next, please. So we can say like we have an SOS from health professionals and healthcare workers because of all these problems and the effect of disasters and climate change on their mental health, and even though they are exposed to these problems, they have to work and take care of others. So what can be the adaptation measures and mitigation measures that can be undertaken to support these health professionals and their mental health issues? So we recommend that they should communicate and maintain contact with their loved ones, and take care of themselves, respects ways people respond to disasters and climate change, and also they should give themselves part of the risk and stay updated with all the information. So they should not forget themselves. They should have food, drink, and have some rest in spite of all this situation. And finally, we have to think about a holistic approach, like how can we mitigate and adapt these problems? So there is a resilience kit or toolkit for health professionals. And this part, like summarize all the problems that happens that can happen to the health professionals, like fear, isolation, uncertainty, frustration, and also the coping mechanisms to be resilient, like religion, experience, proactivity, sense of duty, and other coping strategies. Coping.
Eva, I will stop us here. Thank you so much for that.
Yeah, thank you.
Thank you both. I love both graphics. Yes, the comments coming in are great. We will be doing community events to assess readability, functionality, utility of these pieces. This is just the first start. You get the first dibs on the material. But yes, we will certainly be doing some of those assessments with real community members and making sure that we are meeting the needs of who we are actually serving, right? Because it's always great to put things together and get it all glossy and do handouts, and people just throw them away or use them as coasters. Because I know personally, I've used some of these handouts as coasters in my day. So just being honest, if things don't resonate with folks, there's no utility. So we certainly welcome your feedback and thoughts about what's resonating with you or not, right, as we go through this. So great, thank you both, work group 1 and work group 2. We are coming into our final stretch, and we know that this is the point where folks are going to disappear, right, because it's the breakout room time. But we really would love for you to stay engaged and render some feedback. We're going to split into work groups. Haley, I don't know what we think numbers 5, 6 should work. Yeah, maybe 7 people to a group. Each group will have Earth Medic, Earth Nurse representative in there. And there are some questions that we would like folks to pay attention to. We'll post those questions in the chat as well, just as reminders. Thank you so much, Haley, to keep you kind of in the groove. We will have about 20 minutes, but of course you'll hear me chat to you if time is being a little bit restrictive, just so that we honor your time and finish when we promised we would. So we're going to go ahead and do our breakout pieces now, and the questions are posted in the chat. They involve, where would the material presented be used or displayed for your public, patients, or health providers? Does the material presented communicate clearly what the issues are related to mental health and climate change? And what other questions does the material make people think about? Please document some notes. The guides for each group, please put notes down, and you'll be sending those to me at the end of our presentation, because I'm very serious about getting feedback from folks. I know some people are like, yeah, whatever, she's not going to do anything with it. No, trust me, I'm going to use your feedback. So let's get ready for our breakouts, and I will monitor the time and pull us back for closing in a few. Thank you guys so much. So welcome back, everybody. Hopefully that was a good time spent brainstorming and kind of recapping and thinking through particularly some pieces. I'm putting in the chat where you can email me your notes or thoughts or questions or jokes. I take jokes via email too, folks. It doesn't always have to be serious. Okay, so please send notes to that email address in the chat. I also, again, want to say thank you to our work group members. We can't do the work that we do at Earth Medic, Earth Nurse without our work group members and their co-chairs. So a big shout out to all of you, and thank you all very much for the time and the juggling and the back and forth that goes on. I also want to have a big shout out to Haley, who is my partner in crime for all of this, the lady in front of the blue screen there. So thank you so much, Haley, for keeping us in stride with all of this. And thank you, of course, but of course not least of all of you who have attended and stayed with us throughout our conversation and presentations this evening. I applaud you, honestly, for taking the time to have this type of conversation at this point in time, politically, socially, environmentally. All the leads, as one of my colleagues always says. So thank you. I just wanted to make sure that I let you know we are very grateful for all of you. I want to go ahead and share really quickly with you my screen so that you are made aware of what is coming up next. So we'll be taking, when you email me all those questions, comments, thoughts, ideas, we'll be taking that information and synthesizing it and using it to edit, reformat, redevelop materials as we move forward with our series, because we will be doing listening sessions and kind of focus group sessions for with community members across the region to test these pieces. We're very big on making sure, like I said earlier, that these pieces are responsive and relevant for the communities in which we all serve in the Caribbean region. So we are taking your feedback seriously. I'll also have Haley drop in the chat really quickly the link for those of you who are interested in getting CMEs. Please go ahead and copy that link and give your feedback and your information for those of you who wish to get CMEs. The link is also for those who wish to just let us know some feedback about this session and how it went for you and other thoughts that you may have. So quickly, what I have up is the list. It's relatively solid list. I wouldn't say it's concrete. Before concrete dries, it's soft and still mushy. So I say this is where this is of our topics. We have some flexibility because we know how life happens. So life will always life. So right now we're looking at our next topic to be climate and cancer on January 26th, 2023, right? Followed by cardiovascular disease in February, on the 23rd of February, 2023. And then you see the other dates listed. You can use the same registration access point to register for these pieces as well. So you won't have to struggle to find anything. The same registration that you use to get here will get you there as well. All right. I would like to now turn over and have closing remarks from our founder and our fearless leader, Dr. James Hospitalis. Dr. Hospitalis, please close us out.
Thank you very much, Carrie-Ann. Thanks for everyone for attending this evening and looking at climate change and mental health. In my preparation for this and reading, I realized that from a numeric point of view, the mental health impacts of climate events are many multiples of the physical health impacts, which stands to reason. When Angela Gordon-Stair gave at the commencement of her lecture, she asked us all to think of how did you feel with the last big extreme event that you were involved in or that you saw on the TV or saw in the news. And they make me feel very disturbed. I can tell you where I live, that we are threatened sometimes by forest fires, bush fires. And when they come right up to our property line, I'm afraid for our house and I'm afraid for my family. So that was an interesting note to start on, that the anxiety, the fear, the sense of hopelessness sometimes about the whole climate situation are all mental health impacts that we face. And she spoke a lot about the direct and indirect consequences and the long-term consequences that can happen as a result. The flashbacks. So if you've ever been through a major hurricane, for example, the following year when the hurricane season is declared, you feel anxious again all over. I know my friend William Hamilton, who I saw on the call, told me that he survived Hurricane Dorian, and when the season is announced, he feels anxious all over again, and that was 3 years ago. Angela also talked to us about some of what's needed to strengthen the capacity and things that we can do in terms of counseling, creation of registries, tools, and she pointed to some of the research gaps in climate change and mental health. We then looked at some of the products that are targeted at practitioners and targeted at patients and communities. Thank you, Kesselin, Abigail, Heba, for your summary presentations. These materials don't exist for Caribbean audiences. So this is important work that you're doing. Today, I gave a teaching, a training to 45 primary healthcare doctors in the south of Trinidad. And they are, they've heard about climate change, but all the stuff that we've been talking about in this series, they're not so familiar with. And they asked in the end for materials, practical things. What can we do? What do we need to know? So I think the materials that we're working on will be very useful for people in practice. I don't have so many other closing out remarks. We look forward to seeing you for January, on January 27th. So Christmas is off, Christmas break is off. We hope we have no more hurricanes for the rest of the year. And our audience is many others beside Caribbean people. So we hope there are no freak heat waves or freak fires down under or in Latin America where it's summertime to cause problems. Thanks again to the working groups. You're doing great work, and we will have an outbrief tomorrow with the chairs of the groups. We still have a little time left for if anyone wishes to ask a question or make a comment. Now is a good time to do that. So I open the floor for, and we have questions too from in the chat. Yvonne,
Yeah.
you are roped in. You are volunteered into helping with some of the next steps with these materials.
Good afternoon. How are you?
I'm good. I'm good.
I do not mind supporting in looking at the literacy level,
Okay.
doing that assessment, and the readability level, because they're formally to do that, and we can work out the readability level of each one so we can see if it's at the level we want it to be. And then I think you need to plan for engagement of the stakeholder. Stakeholder engagement is very important in when we're developing health education material, because it has to be first perceived by them and not perceived by us. We're not doing it for us. It really has to be target focused. So I would support in doing the readability.
Thank you, Yvonne. We accept that offer. So Yvonne Lewis, who has just been speaking, is a long-standing colleague, and she was formerly Director of Health Promotion, Health Education in the Ministry of Health in Trinidad and Tobago, and is now running a Master's in Education program at UWI St. Augustine. So I know she would be valuable in helping with things like readability and how you pitch the material depending on the audience. And again, in this work, we've had two main audiences in mind: practitioners on the one hand, who perhaps can handle more technical language, and patients and communities that we definitely, the readability needs to be paid attention to. Joseph Antoine, you have a comment, your hands up?
Yes, yes, good night, Doctor, and good night to the other people on the line. First of all, I want to thank you for the effort to help us to really embrace the whole issue of mental wellness, mental health, mental wellness in the process of preparation for the continuing onslaught of climate change. In fact, today I was on a session in coming out to the United States, mainly based in business and so on, and they were looking at anxiety, dealing with the anxiety that is connected with the impending recession. And I found it was very instructive that it was happening on the same day that we were having something in the Caribbean dealing with the climate situation. So I just want to thank you, but I also want to ask you, Doctor, if you could sometime assist us, because we have some activity which would be able to broaden people's understanding of the climate and environmental, general climate issues. I send you stuff. I don't always get a response from, I haven't got a response from you yet. So I'm just using this opportunity to ask if you could help us. I'm calling from Grenada.
Yeah, thanks, Joseph from Grenada. If you've sent me something and I've not responded, I apologize. I'll put my email in the chat, and please, if you have a request, you can send it. If you wanted someone to speak to a group that you have to help raise the awareness, Earthmedic and Earthless would be happy to do that.
Okay, in fact, sometime in the early new year, we want to talk about a leadership, mental wellness. We don't want to put it in a negativeness, and independence. I mean, trying to combine
Okay,
these
good.
things. So maybe you could help us give us some guidance how we go about that.
I just want to thank you, Joseph. I just wanted to make a quick plug. Folks, please, all notes from your groups need to be sent to kpeart@earthmedic.com. Again, all notes from groups need to be sent to this person over here at kpeart@earthmedic.com. Please, let's not have too many things going on that then become lost and confusing. So once again, please send to me for those notes. Thank you. Just want to make that clear. All right, Joseph, Dr. Hospitalis will search his email, his never-ending email, and double check. But if you could resend the request to see if it could be pushed to the top of his list, that would be absolutely wonderful for the plethora of email I know he weeds through every day as well. All right, folks, we are just about at that time where we have to bid you good evening, good morning, good afternoon, because I know there are different time zones represented. And once again, thank you all very, very much for your time and participation this evening. I'm looking forward to those notes, the feedback as well. And please, for those who want CMEs, utilize that link for feedback and CME sign up. We are looking forward to seeing you on January 26th for our next session. Stay safe and be well, everybody. Have a good night.